I was in pain for several weeks because I thought I had just strained something or pulled a muscle. We did x-rays and they didn't see anything. So I said to the doctor, I think I need an MRI. I had the MRI. After that, it was awful. I had to go to the emergency room. They put me in touch with Dr. Bennion's office and he said, come on over now.
When I met Karen, she was in a world of hurt. She came into my clinic and she would barely let me touch her shoulder. She couldn't lift her arm up.
I couldn't do any of the things that I normally do because it was so difficult and I was in such pain all the time that it was better if I just kept my arm stationary and still.
It's confusing to patients why they all of a sudden have pain in their shoulder when they didn't think that they injured it, but the injury can be such a minor thing that you wouldn't necessarily recognize it when it happens. So as it turns out, Karen had a large rotator cuff tear. So 2 of her tendons were completely detached from their insertion on the bone.
The surgery was to repair the torn rotator cuff of my left shoulder.
20 years ago, this repair would have been done open. This would have been done through a fairly large incision on the anterior lateral aspect of the shoulder, and the patient may even have been admitted overnight. In today's world, many more of these are being done arthroscopically. So an arthroscopic rotator cuff repair involves making a few tiny incisions, about 4 millimeters long, just big enough to put a pencil through essentially. Through those incisions we put an arthroscope that we use to see, and then we can use instruments basically underwater in the shoulder. Through that small space we're able to bring that tendon back to the bone and actually repair it to the bone using the same techniques that we would do open. So she was very relieved to find out that we did not have to make a big incision. This is just done through essentially poke holes in the skin, and that she could go home the same day.
My outcome just absolutely removed the discomfort. I was able to move my arm. Little by little it became so easy for me to raise my arm higher and higher and higher, and now I can raise it over my head, no problem. The recovery was so wonderful. The people that helped me and assisted me made me feel so confident that things would go well and that I would certainly have a wonderful recovery and be able to go back to doing all the things that I used to do.
So it's very gratifying to see somebody like Karen getting back to all of her previous activities. She's playing with her dogs and she's cooking and she's having friends over and doing all those things that she wants to do. That's the kind of thing that makes the whole job worthwhile.